Hi everyone. Today in this video we are going to discuss about D-dimer test and its significance. What is D-dimer? D-dimer is one of the degradation product coming from the blood clot, and it is one of a protein that is obtained after dissolution of the clot. Suppose this is the fibrin meshwork which is cross-linked, which can form a blood clot. This fibrin mesh along with the platelets can stop the blood flow. But when this fibrin meshwork is dissolved, it produces two types of components. Few of the components which are having the different length of fibers, they are called as FDP, fibrin degradation products, and another protein fragment is called as D-dimer. This D-dimer, which is going to be formed after dissolution of the blood clot, is normally cleared. So under normal conditions, we cannot find the significant D-dimer levels. But under abnormal conditions, we can observe the elevated D-dimer levels. So when we can observe there is an elevated D-dimer levels, as we have seen earlier, this D-dimer is going to be formed after the dissolution of the blood clot. So these D-dimer levels are excessively increased in the conditions like excessive clot formation and dissolution. So in any pathological conditions where there is an excessive clot formation followed by dissolution, we can observe elevated D-dimer levels. And particularly this D-dimer test is going to be prescribed when few of the symptoms are observed in the patients. If any patient is suffering from difficulty in breathing, some chest pain, swelling of legs, rapid heartbeat, and persistent cough, if any of these symptoms are observed and there is a significant risk of formation of abnormal clot, in such conditions, D-dimer test is going to be prescribed. So one of such clinical condition where there is an excessive clot formation dissolution is observed is the deep vein thrombosis, commonly known as DVT. And this DVT can lead to another pathological condition, pulmonary embolism, commonly known as PE, where a small clot fragment is going to be blocking the capillaries, resulting in the pulmonary embolism. And even the D-dimer levels may be excessively increased in the conditions like the stroke, where there is an excessive formation of clot followed by dissolution. In all these conditions, D-dimer levels may be excessively increased. But what is the difference between the clot formation in the normal condition and in the thrombosis? Suppose a blood vessel is going to be damaged. It results in the loss of blood leading to hemorrhage. In order to prevent this blood loss, immediately our physiological system is going to activate the platelets as well as the clotting factors which form the fibrin meshwork. And now these platelets and cross-linked fibrin meshwork will form a clot at the damaged blood vessel such that the hemorrhage can be prevented. So this normal physiological process which forms the clot at the damaged blood vessel is called as hemostasis, arrest of the blood flow. So in such conditions, we cannot observe elevated D-dimer levels, but in few of the pathological conditions like the thrombus formation, we can observe excessive D-dimer formation. Suppose this is a blood vessel. Now this blood vessel is not damaged, but still it is forming a clot which is rich in the lipids and other mediators. Now this is the abnormal clot that is going to be found within the intima of the blood vessel, but still it can stimulate the platelets and clotting factors such that the clot formation is further enhanced. So this abnormal clot is called as thrombus. Thrombus is an abnormal clot formed even without damage to the blood vessel. And particularly if you have the risk factors like the obesity, atherosclerosis can increase the formation of thrombus. And this thrombus can lead to the embolism when a small fragment from this thrombus is going to be broken and it is going to block the capillaries. It can block the blood flow at the capillaries. So this can lead to the block of blood supply to the vital organs like the pulmonary organ or brain, resulting in the embolism. And what of this clot is called as EMBOLUS. In this way, the thrombus can lead to the embolus. In these two situations, we can observe excessive clot formation followed by dissolution. So we can observe elevated D-dimer levels within the body. That's why D-dimer test is one of the useful tests to check the formation of thrombus and embolus in the susceptible patients. D-dimer levels can also be increased in few of the conditions where there is an elevated clotting. For example, during the pregnancy, there is more formation of clotting factors which may result in the excessive clotting. In such conditions, D-dimer levels may be increased. Again, after a major surgical procedure, there is a chance of excessive clotting resulting in the elevated D-dimer levels. And even the trauma or head injury may also elevate the D-dimer levels. And few of the infections, particularly if you have the viral infections, can increase the blood clotting, which may result in the elevated levels of D-dimer levels. And finally, malignancy, any cancer in the patients can also increase the clotting, resulting in the elevated D-dimer levels. And in the patients who are in the liver disease can also be affected with elevated D-dimer levels. In all these conditions, we can observe an excessive clot formation followed by breakdown, which results in the excessive formation of the D-dimer within the body. This D-dimer cannot be cleared at the same rate as it is going to be formed. So these levels are going to be increased within the body, which gives a signal such that there is a pathological condition. Suppose this is the blood vessel where the blood clot is formed. This clot is having the fibrin meshwork along with the protein D-dimer. Now this clot formation is going to be controlled by clot dissolving substances. One of the important mediator is the TPA, tissue plasminogen activator. This mediator can act on one of the precursor plasminogen. Plasminogen is one of a precursor, and when this TPA binds to this plasminogen, it can be converted into another mediator, plasmin. Now this plasmin is a clot dissolving substance. It can act on the fibrin meshwork and it can break the fibrin meshwork such that it can be released as fibrin degradation products as well as the D-dimer. Now in this way, as the clot is going to be dissolved, the D-dimer levels are going to be excessively increased. That's why D-dimer test is one of the useful tests. If we are getting a negative value for this D-dimer test, this can rule out that thrombus is not there as well as embolism is not there. So particularly the negative response of the D-dimer test is useful such that we can rule out the conditions like the thrombus and embolus formation in the patients. But when this D-dimer test is positive, it may indicate that few of the conditions like the DVT, deep vein thrombosis, and pulmonary embolism may be present. But these clinical conditions should be further confirmed by a CT scan, particularly one of the CT scan like CTPA, where the pulmonary angiogram is going to be done in order to assess any pulmonary embolism. So what are the D-dimer normal levels? The values of the D-dimer are variable with the analytical procedure. So in many of the analytical procedure, there will be a cutoff value. Normally the cutoff value will be given at 500 nanogram per ml. So when the D-dimer levels are observed above 500 nanogram per ml, this indicates an abnormal value of the D-dimer, which should be immediately monitored, and further clinical examinations like the CT scan should be done in order to confirm any thrombus or embolus formation. But generally the D-dimer values may also be variable with the another factor, rheumatoid factor. If a patient is having the rheumatoid factor, it may affect the D-dimer values. So when this rheumatoid factor is not interfering with the study, and when the D-dimer levels are observed above 500 nanogram per ml, it may indicate a serious thrombus and embolus formation, which is generally confirmed by a thorough CT scan. So that's about the D-dimer test. This is one of the useful tests where it can rule out any formation of thrombus or embolism. These two are serious pathological conditions where there is arrest of the blood flow at the capillaries, which may lead to the coma and death of the patient. So it is always better to assess the thrombus and embolus formation at the early stage. For this, D-dimer test is highly useful. So that's for today. Thank you for watching this video.